Seniors, are you feeling unsteady? Discover the hidden causes of falls. After 60. Have you ever stopped to wonder why so many older adults struggle with balance? It's a common issue, but what's really going on inside the body that leads to this decline? Instability? Balance is something we often take for granted when we're young. Yet, it depends on a sophisticated network of communication between our senses, muscles, and brain. So, is balance loss simply a part of growing older? Or are there deeper, often overlooked reasons behind it? As the years pass, our ability to stay upright and coordinated may gradually decline. This isn't just due to aging muscles or fading eyesight. Numerous factors, from neurological changes to hidden nutrient deficiencies, can disrupt our body's balance systems. Understanding these causes is key to preventing falls, protecting mobility, and preserving independence. What practical steps can we take now to improve our balance, reduce fall risk, and stay active well into later life? In this guide, we'll uncover 12 major reasons why balance deteriorates after age 60. Some obvious, others surprising. Make sure to read through to number 11, which is both the most dangerous and least known of them all. To support your learning, all scientific references used in the creation of this video are listed in the description below. Let's dive in. Why does balance decline with age? As we grow older, a noticeable decline in balance is a common and often underestimated part of the aging process. This decline is not the result of a single issue, but rather a complex interplay of physiological, sensory, and neurological changes that gradually reduce our ability to maintain stability and move confidently. Over time, the systems responsible for keeping us upright and oriented, such as the vestibular system in the inner ear, visual input, muscle strength, joint flexibility, and brain function, start to experience natural deterioration. The vestibular system, located deep within the inner ear, plays a central role in detecting movement, head position, and spatial orientation. As we age, this system becomes less sensitive, making it harder to perceive subtle shifts in body position. Simultaneously, vision, an essential component for spatial awareness and coordination, can be compromised by age-related eye conditions, such as cataracts, macular degeneration, or glaucoma, all of which diminish depth perception and clarity. On the physical side, muscles tend to lose mass and strength, a condition known as sarcopenia, while joints may become stiffer and less responsive due to conditions like osteoarthritis. These changes limit mobility and reduce the body's ability to quickly correct itself after a misstep or imbalance. Reflexes also slow down, meaning it takes longer for the body to react to sudden changes in movement or posture, which significantly increases the risk of tripping or falling. Equally important is the central nervous system, which interprets incoming sensory information and orchestrates the body's responses. With aging, this system may become less efficient, delaying communication between the brain and the body. When these sensory and motor delays combine, maintaining balance becomes not only more difficult but also more dangerous, increasing the risk of serious injuries such as hip fractures or head trauma from falls. Despite these challenges, the good news is that balance does not have to deteriorate uncontrollably with age. With targeted interventions such as balance training, strength exercises, physical therapy, and even practices like Tai Chi or yoga, older adults can significantly improve their stability and confidence. Regular physical activity, proper vision and hearing care, and a safe living environment are also crucial in minimizing fall risk. By understanding how aging affects balance and taking proactive steps, individuals can maintain mobility, independence, and a higher quality of life well into their later years. 12. Sedentary lifestyle, the silent threat to your stability. One of the most harmful yet overlooked contributors to poor balance in later life is a sedentary lifestyle. After 60, inactivity becomes particularly detrimental. Without regular movement, muscles begin to waste away, atrophy, flexibility declines, and endurance diminishes. The human body was built for movement. Sitting or lying down for prolonged periods weakens the muscles needed to support your posture and mobility. The result is a reduced ability to react quickly to prevent a fall. Inactivity also often leads to weight gain, putting extra pressure on joints and bones and further increasing the risk of imbalance and falls. Moreover, a sedentary lifestyle can impair cardiovascular health, slowing blood circulation and affecting how your body adjusts to changes in position, like standing up, sometimes causing dizziness. Incorporating daily physical activity, such as walking, stretching, and strength training, can dramatically improve balance, mobility, and overall quality of life. Maintaining an active routine helps older adults stay independent, confident, and safer in their everyday environments. 11. Vitamin B12 deficiency, the hidden danger to nerve function. A deficiency in vitamin B12 may not be immediately obvious, but it can severely impact balance and coordination. This essential nutrient supports the nervous system and the production of healthy red blood cells. As people age, their ability to absorb B12 diminishes, often due to dietary changes, gastrointestinal conditions, or medications. Lack of B12 can cause numbness, tingling in the hands and feet, unsteady gait, memory issues, and trouble concentrating. These symptoms stem from damage to the myelin sheath, a protective coating around nerves, which disrupts communication between the brain and the rest of the body. As the nervous system falters, so does balance. B12 deficiency can also lead to anemia, a condition that reduces oxygen delivery to tissues, causing fatigue and muscle weakness. Since symptoms may appear gradually and subtly, many people remain unaware of the problem until serious effects arise. Regular blood tests, dietary adjustments like increasing intake of fish, eggs, meat, and dairy, and supplements can help correct the deficiency. Consulting a healthcare provider for testing and treatment is crucial to prevent long-term complications. 10. Dehydration, the overlooked risk that can topple you. Many people underestimate the role of hydration in maintaining balance, especially as they age. Older adults often experience a reduced sense of thirst, which can lead to chronic dehydration. Certain medications and conditions such as diabetes or kidney disease can further increase this risk. Water is vital for regulating body temperature, maintaining blood pressure, and supporting joint and muscle function. When dehydrated, blood volume drops, leading to a decrease in blood pressure. This can trigger dizziness or lightheadedness, especially when standing up too quickly, a phenomenon known as orthostatic hypotension. These episodes significantly increase the chance of falls. Additionally, dehydration affects mental clarity, causing confusion and fatigue, both of which impair physical coordination and stability. To combat this, older adults should aim to drink fluids regularly throughout the day, even in the absence of thirst. Including hydrating foods like fruits and vegetables and limiting caffeine and alcohol, which promote fluid loss, also helps. Staying properly hydrated is one of the simplest yet most effective ways to support your health and protect your balance. 9. Diabetes, the hidden threat to your feet and balance. Diabetes is a long-term, complex health condition that affects millions of people worldwide, and its consequences extend far beyond managing blood sugar levels. One of the lesser-known but highly impactful aspects of diabetes is its potential to disrupt balance and mobility, especially in older adults. When not properly managed, diabetes can silently damage various systems in the body that are crucial for stability, increasing the risk of falls and serious injuries. One of the most significant complications related to diabetes is peripheral neuropathy, a condition where high blood sugar levels damage the peripheral nerves, particularly in the feet and legs. This nerve damage can result in numbness, tingling, burning sensations, pain, and muscle weakness, making it difficult for individuals to detect pressure, temperature, or the position of their feet. When a person cannot feel where their feet are on the ground, maintaining balance becomes a daily challenge, especially during activities like walking, climbing stairs, or standing up from a seated position. Beyond nerve damage, diabetes also contributes to poor blood circulation, particularly in the lower extremities. Reduced circulation can delay wound healing, increase vulnerability to infections, and lead to conditions like ulcers or even gangrene in severe cases. These complications not only impair foot health but can also cause pain or physical limitations that further restrict movement and coordination. Furthermore, high blood sugar, hyperglycemia, can impair other essential systems involved in balance. Vision, for example, can deteriorate due to diabetic retinopathy, cataracts, or glaucoma, all common among individuals with long-term diabetes. Impaired vision compromises depth perception and spatial awareness, making it harder to judge distances or avoid obstacles. Cognitive functions may also decline with diabetes, affecting memory, attention, and reaction time, all of which are important for avoiding falls and maintaining postural stability. These layered complications are particularly concerning for older adults, who may already be experiencing natural declines in muscle strength, reflex speed, and sensory perception. For them, diabetes adds an extra burden that significantly raises the risk of falls, a leading cause of injury and hospitalization in the aging population. To mitigate these risks, Proactive diabetes management is essential. This includes maintaining stable blood glucose levels through a balanced diet, regular exercise, and prescribed medications. Daily foot care routines, such as inspecting for cuts, swelling, or changes in skin color, can help catch problems early. Wearing properly fitted, supportive footwear is also crucial in protecting the feet from injury and enhancing stability. Most importantly, routine medical visits with both an endocrinologist for diabetes management and a podiatrist for foot care are vital for preventing complications before they become serious. By staying informed, vigilant, and engaged in their own care, individuals with diabetes can greatly reduce their fall risk, maintain better balance, and enjoy a more active, independent lifestyle. 8. Hypertension, the overlooked cause of dizziness. When standing, although commonly associated with high blood pressure, hypertension can also manifest as orthostatic hypotension, low blood pressure upon standing, that often goes unnoticed. This condition reduces blood flow to the brain during postural changes, causing symptoms like lightheadedness, dizziness, blurred vision, or even fainting. The risk increases with age as the body's ability to regulate blood pressure naturally diminishes. Sudden transitions from lying or sitting to standing can trigger these effects, significantly raising fall risk. Medications, dehydration, and long periods of inactivity can worsen the issue. Left unmanaged, orthostatic hypotension can cause recurring instability, making everyday tasks more dangerous. Management strategies include rising slowly from beds or chairs, staying hydrated, avoiding prolonged standing, and adjusting medications with medical supervision. Compression stockings may also help enhance circulation. A thorough evaluation by a healthcare provider is critical to accurately diagnose and effectively treat the underlying cause of dizziness and prevent further complications. 7. Medications, the surprising culprits behind balance issues. Many older adults rely on multiple medications to treat chronic conditions, but these drugs can carry unexpected side effects that disrupt balance and coordination. Common culprits include medications for high blood pressure, antidepressants, anti-anxiety drugs, sedatives, and even over-the-counter pain relievers. These can induce dizziness, fatigue, drowsiness, or orthostatic hypotension. Polypharmacy, the use of several medications at once, can amplify side effects and lead to dangerous drug interactions. Age-related changes in metabolism can further complicate how medications affect the body, increasing sensitivity and risk of adverse reactions. It is crucial for older adults and their caregivers to monitor symptoms and stay informed about the potential effects of every medication, including supplements. Maintaining a detailed and updated medication list, regularly reviewed by a pharmacist or physician, can help identify interactions or side effects. In some cases, adjusting dosages or switching medications may be necessary, but this should always be done under medical guidance to avoid worsening health conditions. 6. Inner ear disorders. How vestibular problems disrupt balance. The vestibular system, located in the inner ear, is essential for maintaining balance and spatial orientation. Disorders affecting the system, such as benign paroxysmal positional vertigo, BPPV, labyrinthitis, and Meniere's disease, are particularly common in older adults and can severely impair mobility and confidence. Symptoms of vestibular dysfunction include vertigo, a spinning sensation, nausea, dizziness, blurry vision, and unsteadiness, especially during quick head movements. These sensations can be disorienting and lead to falls, as well as anxiety around performing simple tasks like walking on uneven surfaces or turning suddenly. Treatment options vary based on the condition but may include vestibular rehabilitation exercises, canalith repositioning maneuvers, and medications to manage symptoms. Seeing a specialist such as an otolaryngologist or audiologist is important for proper diagnosis and tailored treatment plans aimed at restoring balance and improving quality of life. 5. Neurological conditions. When the brain undermines balance. The brain coordinates sensory input from the eyes, ears, and body to maintain balance. Neurological disorders like Parkinson's disease, stroke, and multiple sclerosis, MS, can severely disrupt this coordination, leading to instability and increased fall risk. For example, Parkinson's disease is characterized by muscle stiffness, tremors, and slow movements, all of which hinder the body's ability to adjust to changes in posture or position. A stroke may damage areas of the brain that govern motor control, resulting in weakness, loss of coordination, and impaired gait. MS, which damages the protective covering of nerves, can cause a variety of symptoms including balance issues, fatigue, and muscle spasms. These neurological challenges can severely impact independence and self-confidence. Treatments may involve medications, physical or occupational therapy, and sometimes surgical interventions. Ongoing medical care, lifestyle modifications, and supportive therapies are critical for managing symptoms and helping individuals maintain as much independence as possible. 4. Stiff joints, the underestimated barrier to mobility. Aging often brings joint stiffness and discomfort, typically associated with osteoarthritis, a degenerative condition where the protective cartilage in joints deteriorates. This leads to pain, swelling, and limited movement, especially in weight-bearing joints like the hips and knees. Stiff joints can directly interfere with balance and increase the difficulty of everyday tasks like walking, standing up, or climbing stairs. Pain often causes individuals to avoid movement, but inactivity can worsen joint stiffness and lead to muscle weakening. Additionally, altered movements to compensate for pain may result in imbalances elsewhere in the body, increasing the risk of falls. Management options include medications to reduce pain and inflammation, physical therapy to improve flexibility and strength, and in severe cases, joint replacement surgery. Maintaining a healthy weight, staying active with low-impact exercises like swimming or walking, and using mobility aids such as canes can greatly enhance joint function and prevent further decline. 3. Muscle weakness, the hidden challenge to balance. Loss of muscle mass, or sarcopenia, is a natural part of aging that can quietly undermine balance and physical function. Weak muscles provide less support for joints and bones, making it more difficult to maintain good posture and react quickly to changes in body position. In particular, weakness in the legs and core muscles can severely impair an individual's ability to stand, walk, or recover from a stumble. This weakness can also contribute to poor posture, joint strain, and an increased dependency on others for daily activities. Fortunately, muscle weakness can be effectively addressed. Engaging in resistance training using weights, resistance bands, or bodyweight exercises can help rebuild strength. Balance and flexibility exercises such as yoga or Tai Chi also improve coordination and reduce fall risk. A structured exercise routine tailored to individual ability levels, ideally guided by a physical therapist or fitness professional, can significantly improve stability and enhance quality of life. 2. Hearing loss, the silent saboteur of your balance. Hearing loss, often considered merely a communication barrier, is actually a silent yet significant threat to balance, especially in older adults. While we typically associate the ears with hearing alone, they also house the vestibular system, which is responsible for maintaining equilibrium and spatial orientation. The inner ear contains both auditory and balance-related organs that send critical signals to the brain about head movement and body position. When hearing begins to deteriorate, the quality and accuracy of this sensory input can be disrupted, leading to impaired balance and an increased risk of falls. Moreover, individuals with hearing loss may struggle to detect essential environmental cues, such as the sound of footsteps, vehicles, or warning signals, which are crucial for navigating safely and confidently in daily life. This sensory deprivation can create a feeling of disconnection from one's surroundings, contributing to social isolation and reduced confidence in mobility. Compounding the issue, hearing impairment is linked to cognitive decline. Decreased auditory stimulation over time can reduce brain function, further impacting coordination, attention, and spatial awareness, all of which are vital for maintaining balance. To counter these risks, it's vital for older adults to undergo regular hearing assessments. If hearing loss is identified, timely use of hearing aids or assistive listening devices can not only enhance auditory perception, but also indirectly support better balance and mobility. By improving access to environmental sounds and reducing mental strain, hearing aids can contribute to greater overall safety, helping individuals stay active, independent, and connected to the world around them. Maintaining balance as we age involves more than just strong muscles or flexible joints. It requires a fully functioning sensory system, including hearing. The connection between hearing loss and physical stability is often underestimated, yet it plays a vital role in how we interact with our environment. By recognizing the broader impact of hearing impairment, individuals and caregivers can take proactive steps toward prevention. Prioritizing hearing health is not just about better communication. It's about preserving independence, reducing fall risk, and enhancing overall quality of life. Incorporating hearing health into a comprehensive wellness plan is essential for aging safely and confidently. Through early detection, routine checkups, and proper use of hearing aids, older adults can mitigate the dangers associated with diminished auditory function. Investing in hearing care empowers individuals to stay engaged in their communities, move with greater assurance, and maintain their autonomy longer. As we continue to explore the hidden contributors to balance issues, hearing loss deserves a central place in the conversation.